Welcome to the Nth Degree, where we talk about the latest trends, technologies, and innovations that are happening across the healthcare and media spaces. I'm Amanda Preto, and I'm happy to be joined today by Josh Simon, who is the Senior Vice President of Centered, which is CMI Media Group's Social Center of Excellence, along with Craig Beyerle, who is the Director of Social Engagement and a driver of Centered as well. Social and content may be a different space for your brands to play in, but with innovation always in mind, we're here to tell you how and why it can work. So let's get started. Hi, Josh. Thanks for being here today. Let's just hear all about it. Centered is an amazing offering within CMI Media Group, and I'd love to hear about all of the fantastic work your team is doing.
Yeah, thanks. So Centered was born out of our social center of excellence about 3 years ago, and it was really driven on our governance and guidance work. So sort of bridging together all our social services from paid social to social intelligence, but then additional disciplines like guidance development, platform enablement, and that type of thing. But we've really started to build out our other two pillars, which are influencer. So building out influencer programs for both patient and HCP, and also what we call digital media production, which is content development for media programs. So think optimizations, quick edits to get you on the channels that you want to be active on, or create those optimizations to make your media perform better.
That's amazing. So let's keep going. So I know there is a lot of breadth and depth within Centered, and you just touched on a couple of core offerings within it, but I'm very interested in the influencer space, and I have a feeling that our clients will be too. So Craig, I'd love to pass it over to you. Why should healthcare and pharma brands consider an influencer strategy?
Yep. Great question, Amanda. So what we've seen over the past, I want to say about like 2 years or so now, that the influence space is just growing, right? And it's not just, outside of healthcare. It's actually growing specifically within healthcare. And we've seen a lot of HCP influencers become these content creators. So outside of their, day-to-day job where they're busy in the hospitals, they're also taking time to develop these specific custom videos across Instagram and TikTok about updating or new data that's being released, anything about new brands that are, getting FDA approval, and how patients and caregivers can kind of, get those messages and how they might be able to apply them for their specific disease states.
It's such an exciting strategy that I think, is maybe not top of mind and not obvious. So Josh, how do you know when the influencer is right for your brand strategy?
Yeah, so really looking at our influencer process, when someone comes up to us and they're interested in influencer, we start by doing identification to see who might be relevant and start vetting appropriate influencers. We also might already have some data from our social intelligence team to tell us who is influential in the space. But from there, we want to find out who's actually creating content, because really the beauty of these programs is to have someone who has their own unique perspective. They're not just sitting there and smiling at the camera and just taking a picture with a product. We're looking for someone who can create content that's unique. And I sort of equate this to sort of working in an industry that you're not totally familiar with. So having an HCP or a patient's perspective, a creative person's not going to be able to have that same storyline. So being able to partner with someone like that, they're just going to have such a unique perspective and tell a story that's just so unique. So finding someone who already has that story in place and can communicate your message is really what we're looking for.
Yeah, I agree. I mean, I know as a patient consumer myself, the influencers who I trust, right? So, Craig, from a more centered, holistic view, how can brands start to think about building this into their strategy? What should our clients be thinking about?
Yeah, so the first thing we want to do is like we got to hone in on the research, right? Research, research, research. We need to really understand where is our audience. What platforms are they on, and what platforms are they not on. And then from there, we'll start to understand kind of what's being said on these platforms, so understand the sentiment about these brands or about this specific disease state. And that way we can start to own in, what should the brand be answering, or what should we trying to, teach these patients or other HCPs about what's needed. For once we kind of have that understanding, then we'll kind of start our, crawl, walk, and run approach. really start to kind of dip our toes into this. And then from there, have our insights and our findings and how we can better start to evolve this campaign to something larger, where we'll want to be on those Facebook accounts, those Instagram accounts, and then maybe start to explore into TikTok and then even into Reddit, LinkedIn, and YouTube. Start to have kind of a holistic approach.
Yeah, makes sense. Do you have any good examples you could share? Case studies, examples, influencers who you think have been really effective and impactful for any brands we've worked on? Obviously, we won't mention the brands by name.
So, one of the things that we are just getting launched in right now is, working with a vaccine and how we're leveraging Instagram for that to reach other pharmacists. But with this key messaging, as we want to reach pharmacists, we also want to make sure that we're tapping into this consumer audience as well. So we're kind of having a two-layer approach here where we have specific messaging for pharmacists, but also making sure that this messaging is going to translate over into that patient and caregiver audience so they also understand what their options are.
All right, great. So, Josh, where are you seeing there are some opportunities and maybe some challenges that health brands should be aware of?
Yeah, I'm going to start with the challenges. I think what we see is if you haven't done these programs before, just establishing your processes from just what the influencer compensation is going to look like, especially if it's going to be HCPs. We know that compensation is going to be a lot different from a typical fair market hourly rate. Influencers are going to be looking for the rate they're getting from other companies, whether it's pharma or outside of the industry. So coming to that agreement on what the compensation will look like is very important. Nailing down your contracting strategy. These are all things that you want to have up front. But I think the biggest thing is what makes it really unique is the video content, which is a lot harder to do in pharma. If you have some sort of spoken claims, you're likely going to have to speak to safety. It makes for a really long video. Not every brand has done this type of video content before, so you're solving two problems at once of figuring out how to run an influencer program, but also figuring out how to do unique video content. From there, though, I think that that is your opportunity. You really open up your brand to this whole new content strategy that's very difficult to accomplish without an influencer. It's really hard to be authentic. It's really hard to come up with a unique perspective, and you really get to augment your content strategy. You won't have to build as much video content uh, through brand forward content. Um, but you'll be able to have this unique perspective flow into your content strategy that augments you currently have within your own content strategy.
Nice. A nice way to turn an opportunity from a challenge. So, nicely done. Thanks. Craig, what are your thoughts?
Yeah, so I think, a lot of times when, say, for example, we work on an oncology brand, you want to work with an oncologist influencer, and sometimes we might have a lot of limitations, identifying that influencer, and if they're able to kind of partner with us due to, their pre-existing contracts or any other type of academia that they may be locked in with already that would limit them in partnering with us. So we want to start to think of how we can, still reach an influencer that's maybe outside of, an oncologist, whether that be a nurse practitioner or a physician's assistant that already have those skills within the oncology space.
All right. Well, Josh and Craig, thank you so much for joining us to walk us through what is a very interesting but also complex strategy for brands. I know I'm influenced. I will follow your lead. You're both influencers across CMI Media Group, and I thank you for being here today. There are so many touch points within Centered. As Josh mentioned early in our episode, there is also digital media production as well as guidance, a lot to cover and too much for an nth degree. So stay tuned for a deeper conversation coming this spring in our live series called The State of. And with that, thanks for joining the nth degree. We'll see you soon. Remember to like and subscribe.